My name is Erika, and I will be presenting long-term cognitive and behavioral outcomes of neonatal hypoglycemia, a review of early detection and intervention strategies. Okay, so let's begin. Sorry. Yeah. Neonatal hypoglycemia is the most common metabolic disturbance in newborns, particularly those that are preterm or low birth weight. Here we can see in this chart a correlation between birth weight and the risk of recurrence of hypoglycemia. And we can see that the lower the weight of a newborn is, the higher chance of hypoglycemia to occur. So while short-term outcomes are often managed effectively and have clear guidelines, concerns are about long-term cognitive and behavioral impacts of early life hypoglycemia in later development. So, primary objective was to review those long-term cognitive and behavioral outcomes in children with history of neonatal hypoglycemia, and secondary objects included evaluation of various early detection strategies and intervention strategies for the most effective way to minimize adverse neurodevelopment outcomes. We used a systematic review and databases, 3 databases, PubMed, Scopus, and Cochrane Library, and we included studies that examined long-term cognitive, academic, and behavioral outcomes in children with a history of neonatal hypoglycemia, and also we included I'm sorry, do you see my slides? I'm sorry, did you see my slides? Because okay.
Can you open your
Okay.
slide onto the presentation mode, please?
Yeah. You can see now?
Yes, you can start at the objective.
Okay.
Yeah.
It twitched. Okay. So let's continue
No,
to the
make it
results.
larger to the presentation mode, please.
Larger? Okay, I will try.
It's like a handout mode
Could you do the slideshow, please?
or slideshow.
Yeah. If not, your slide is not move when you talking.
Yeah. I got the message that sorry.
The light, I mean, in the bottom in the bottom right.
Excuse me, can you
bottom right.
excuse me, can you not sharing and then sharing again?
Yeah, I'm not sharing now, right?
Can you present the view, optimate, F5, please?
Now you see the view of my screen, right?
Yes.
Yes.
And now,
Yes.
now you can see the slides.
Yes.
I'm thinking. Yeah?
Oh, yeah, that's very
Yes.
good.
Yes.
Yeah,
Okay,
that's work. It's
I can
working.
continue.
Yes, please.
Okay, I will continue then. Yeah, so what were the results? We included 30 studies with over 10,000 participants, and what we found. So we found that executive functioning delay, working memory impairment, and attention deficits were more prevalent in hypoglycemia group. So there we can see a comparison to control group, and hypoglycemia group experienced about 2 times more those neurodevelopment outcomes, a higher risk for those that had a history of hypoglycemia in neonatal period. Also, behavioral and learning problems were also prevalent. Here, Also, we can see comparison, hypoglycemia and control group comparison. Still, ADHD and learning difficulties are more prevalent in hypoglycemia group. So next we move to early glucose monitoring and timely interventions. We can see that giving the right intervention and detection strategies can significantly reduce the risk of cognitive impairments. So what interventions did we investigate? We investigated oral feeding, both breastfeeding and formula, IV glucose, oral glucose gel, continuous glucose monitoring, and combined early detection and intervention method. So we can see that the most effective way was combined early detection and intervention method, because it has the higher chance, the fastest hypoglycemia resolution within 1 hour, lowest rate of neurological complication short-term and long-term. And least effective of these interventions was oral glucose in the middle. And IV glucose is also very similarly effective to early combined detection and intervention. Next, we have detection strategies, and we investigated detection by time to detection and comparing time to intervention by using hours. So the most effective way was here also was combined, because time to detection was 15 minutes and time to intervention was only half an hour. So it had the smallest gap between detection and intervention, which makes it most effective. And the least effective way investigated was intermittent blood glucose testing, and it has 1 hour gap. So based on this, it would be least effective, and potentially neonatals may have immediate and long-term outcomes worsened in this case. So to sum up everything, average cognitive score in early intervention group was higher compared to late or no intervention group, and percentage with severe impairments was significantly lower in early intervention group, being 10%, and late or no intervention group had 65% recurrence of adverse severe impairments. And percentage with no significant impairments was higher in later no intervention group, and early intervention group has a smaller, but it's similar. Yeah. And what's our conclusion? So neurodevelopment outcomes are more incident in neonates with history of hypoglycemia. Time interventions are key to reducing cognitive and behavioral impacts. Comprehensive care protocols for high-risk infants should be prioritized. Early detection improves long-term neurodevelopment outcomes, and more studies are needed to clearly define the relationship between specific intervention and long-term cognitive and behavioral outcomes. Okay, so thank you for your time, and now time for questions, I think.
Okay, thank you so much. Such an interesting topic. Do you have any comments or any questions?
Thank you for presentations. For your searching about the hypoglycemia, do you classify as a type of the hypoglycemia, for example, profile hypoglycemia or persistent hypoglycemia? Because I think that the neurodevelopmental outcome may affected with the profile hypoglycemia, not only benign or intermittent hypoglycemia. Can you explain that?
Yeah, in this case, we used the generalized findings of hypoglycemia. Hypoglycemia type is very depends on the neonatal birth weight and the gestation week when the neonate was born. So in preterms, hypoglycemia is a little bit different and has different outcomes than in babies that are born full term. And just like full-term low-weight neonates will have different hypoglycemia and outcomes later than those that are preterm, because preterm babies just have less storage of glucagon in their body. So they react a little bit differently to glucose metabolism and medications that are used to treat it. So I guess our future focus would be to clearly define that different types of neonates should have specific guidelines that could be achieved the best outcomes for the patients.
Okay. For my recommendation for the accurate outcome, I think you may classify the level of hypoglycemia because blood glucose lesser than 45 milligram per deciliters determined as hypoglycemia, but the newborn infants blood glucose 40 determined as hypoglycemia, and some babies 20 milligram per deciliters. This is hypoglycemia also. So my suggestions, you might classify the level of the lowest level of the blood sugar to determine the neurodevelopmental outcome. So this is only for my suggestion to classify in the beginning and determine the outcome.
Oh, okay.
That should be
we
accurate.
had it more clear in the review, but it's just for the time's sake and to fit in those 7 minutes for presentation. Okay. So we didn't specifically clarify because we used also Prisma flowchart, but we didn't put it here just for the sake of space and time.
So that's great. And other things for neonatal periods, if that infants has a their neurodeficits such as seizures or hypotonia, you can note in your report also. That should be
also clarify that. Yeah.
Okay. Yeah. Thank you for presentation.
Okay. Thank you for your time and questions.
Any more questions from our judges? Okay, thank you so much.